Ask Our Doctors Day devoted entirely to those medical issues that make a lot of you very uncomfortable. Everyone always wonders, am I normal? And right now we're answering more of the questions you've always wondered about. Skin tags, 46% of the population. We've all had them. People who are obese tend to have more of them.
It's a very simple thing to remove. Different ways you can do it. You can burn it off. You can freeze it off. You can cut it off. You can actually tie it off for a larger tag. You actually put a suture around at the base, strangle the blood supply, and it eventually falls off. So
we have Dr. Will Kirby here, a dermatologist, as well as Vito, who's been suffering from a skin tag for over 10 years that we're going to remove here today on our stage. So, gentlemen, come on out here and meet me. Vito, welcome. Good to see you, Doc. Good to see you again. So, where's this skin tag that's been bothering you?
It's right here underneath my arm.
Which, very commonplace for these.
Yeah, he has a really typical skin tag there. The medical word is acrocordon, but we know them as skin tags, and they're exceedingly common. Like you said, about 50% of the population has them. They're very easy to remove.
And big reason you shouldn't try to remove these at home.
Well, the main reason is you can get a secondary infection. I see it probably about once a month. I have someone who comes in, they had a skin tag, they picked it off, they cut it off with nail clippers, and they get an infection. It's really simple, though. I'm just going to clean it with a little bit of alcohol here. Little tiny pinch here, Vito, on 3. 1, 2, 3, little tiny stick. That's all you're going to feel there. You doing okay with that?
Yeah.
And I'm just injecting a little bit of lidocaine with epinephrine, just to make sure he's nice and numbed up.
And the nice thing about this medicine that Dr. Kirby's injecting is it'll actually constrict the blood vessels so there's less bleeding, which is another problem if you try to do this at home. These things can bleed.
Now I'm going to do a little tiny snip here, Vito, on 3. We'll just do it on 3. 1, 2, 3, little tiny snip. Completely gone there. I'm going to cauterize the base with just a little bit of hyfrication here. So you might smell this and hear this, but you won't feel it. It wasn't bad. You weren't in pain, right?
I didn't even feel
anything.
anything.
Feel it. Beautiful. Little tiny burning here.
So that'll destroy any residual tissue
exactly
at the base of the skin tag.
And we're really done. It was that simple. We're going to put a little Band-Aid on it. Moving on. There is one other thing about skin tags that concern me a little bit, and sometimes when people have skin tags downstairs, it's actually not skin tags. You're all set, buddy.
Wow.
It's actually associated with human papillomavirus, so they can look exactly like a skin tag, but if it's in the groin area, it very well could be genital warts.
Thank you both for being here. From the bedroom to the bathroom, nothing is off limits today. Up next, find out how you can have the best orgasm of your life.
Wow.